Stop. Before you quit the gym, listen carefully. Here is the evidence-based truth. Regular movement lowers your long-term stroke risk. But after 60, some training habits can cause extreme, short-lived blood pressure spikes, dizziness, or dangerous strain, especially if you are deconditioned or your blood pressure is not well controlled. Today, I am not giving you 8 forbidden exercises. I am giving you 8 situations to modify, so you keep the benefits and cut avoidable risk. 1 safety rule first. If exercise causes chest pressure, fainting, new weakness on one side, trouble speaking, sudden severe headache, or severe shortness of breath, stop and seek urgent medical help. And if you have uncontrolled high blood pressure, known heart disease, known rhythm problems, or a recent stroke or TIA, your intensity should be planned with a clinician or physiotherapist. Now, the list. Number 8. Long toe touch holds right after a walk. Stretching can be useful, but do not hold your breath and do not stand up quickly if you get lightheaded. Use a chair for support. Keep holds gentle, about 20 to 30 seconds, easy breathing. Number 7. High-impact jumping when balance or joints are limited. For many people over 60, the real risk is falls and joint overload. Swap jumps for step-ups, sit-to-stands, or brisk incline walking. Number 6. Extreme cold plunge or hot and cold shock. Cold can cause a rapid blood pressure rise. If you have hypertension, coronary disease, or rhythm issues, be cautious and get medical advice before extreme cold. If you still do it, keep it mild, brief, and never alone. Number 5. Long maximal isometric holds, like a hard plank. Isometric strain can raise blood pressure in some people. Prefer shorter holds with calm breathing or dynamic core work like bird dogs and dead bugs. Number 4. Heavy lifting with breath holding, Valsalva. This is the biggest avoidable mistake. Rule: exhale on effort. If you cannot breathe through the repetition, the load is too heavy today. Choose controlled reps, moderate resistance, full control. No grinding, no straining, no red face. Number 3. The 0 to 60 workout right after waking. Yes, vascular events cluster more often in the morning.
That does not mean morning exercise is forbidden. It means hydrate, warm up longer, and build intensity gradually, especially if you feel stiff, dizzy, or you take morning blood pressure medicine. Start easy, earn intensity. Number 2. HIIT taken to extremes without screening. Intervals can be appropriate for some older adults, but do not chase a teenager's heart rate. Use the talk test. During the hard parts, you should still be able to say a short sentence, lower voice. If you have known atrial fibrillation, frequent palpitations, or dizziness, your intensity targets must be individualized. Number 1. Very intense workouts right before bed, if they ruin your sleep. Sleep is when your brain and blood vessels recover. If late hard exercise keeps you wired, move it earlier. But gentle evening movement, easy walking, or light mobility can be fine. Bottom line, after 60, you do not need to be fragile, you need to be strategic. Keep the pillars: aerobic activity, strength, balance, and mobility. Avoid the 2 big risk amplifiers, breath-holding strain, and sudden extreme shock exposures. I'm Professor Oleksii Kalmykov. Stroke prevention is not about fear, it's about good decisions repeated daily.